1 in 10 Canadians choose not to get the prescription drugs they were given by their doctors because of out-of-pocket costs. Dr. Steve Morgan explains that a national Pharmacare program would ensure that Canadians have access to a more complete and sustainable healthcare system.
When a patient chooses not to fill a prescription, sometimes that leads to a worsening in health status because maybe the prescription was to treat the risk of a future illness. When that happens, those patients end up in hospitals. Not only does their health suffer, but we as a society pay the extra burden of actually having them hospitalized. So our lack of coverage means that Canadians aren't getting care that they need and that we are paying more in the long run.
Canada is currently the only developed country with a universal healthcare system that does not include universal coverage of prescription drugs, and paradoxically, it is the most expensive one. He explains how Canada could save millions of dollars by adopting a national Pharmacare program.
Because we don't have a universal system for purchasing prescription drugs as a country or even as any given province, we actually don't exercise the level of purchasing power that Canada ought to exercise in the world market for pharmaceuticals. It's not just purchasing as 10 individual provinces and 3 territories. There's literally hundreds of private insurance companies that all run their own drug plans and therefore, in essence, divide the market into little tiny pieces that have very little market power. As a consequence, Canada actually pays among the highest prices in the world for both brand name and generic drugs.
Provinces would need to work together on building a Pharmacare program in order to have the upper hand on pharmaceutical manufacturers, adds Dr. Morgan.
Our very staunch view about provincial autonomy concerning drug coverage decision-making actually favors the manufacturers of medicines who can play provinces off against each other in terms of coverage policy. And as a consequence, you end up with decisions that may not be based on good economic and clinical considerations, but more on politics of keeping up with the neighbor. And in the end of the day, that actually costs the country more than is necessary.
In fact, Dr. Morgan says that Canada should try to emulate the purchasing power that the Liquor Commission Board of Ontario has when buying wine around the world.
We need to create a national purchasing body that makes us the best customer in the world for the pharmaceutical companies that would be courting our business. And they would be doing things such as reducing their price, but also providing guarantees that if there's a global shortage of their medicines, that we are the first customer to get medicines from them as a supplier.
A growing number of health professionals, patients, community groups, and politicians are calling for a national Pharmacare program, but politicians will need the support of the population in order to implement such a program, adds Dr. Steve Morgan.
And those people who benefit from the status quo, there are many. There's the private insurance companies, there's the retail pharmacies, there is the manufacturers of generic drugs and the manufacturers of brand name drugs. They're all very powerful interests that would like us to stay, in essence, the same as we are today. And governments don't want to take on opposition from those kinds of interests unless Canadians across the spectrum say, we really want the government to fight to get Pharmacare in place so that in the long run we have universal access to care we need and that we're getting that care at a price that is affordable and reasonable in the world market.
For Evidence Network, I'm Mélanie Meloche-Holubowski.